I'm here with Tammy Tiskovich of TriCounty Home Health.
Morning.
Good morning, Tammy. How are you today?
I am very good.
Good.
Very
Welcome. And I'm excited to let people know a little bit about TriCounty Home Health Care. So, can you tell us a little bit about your background? When did you get started in this?
I started in, I'm a nurse, I'm an RN. I've been an RN for 40 years. I've been in home health for 30. And over 20 of that has been in the Pottstown area.
Excellent. Yeah. So you know the area, you know the community.
Exactly.
Good. Good.
Yeah,
Good.
it's a special place.
Yeah, yeah, it's growing and a lot going on here. So, what do you all do? Tell us a little bit about what you do.
TriCounty Home Health provides skilled medical home care. It's on an intermittent basis. It's for patients that are homebound that can't get out to go get their care somewhere else, like outpatient therapy, or can't even get to the doctor's office that easily and need to be seen a little bit more often. It's skilled medical, therefore we need physician orders. It's not come and just take care of mom because she can't really be alone. It's teaching people how to be safe, to live safely in their home, how to make sure that they know how to take their medications properly, therapy to get stronger so that they can be safe in their home and stay there for a long period of time.
Yeah, so I would imagine this is a real growing industry in today's market.
It absolutely is. People want to stay home. They don't want to wind up, sometimes a facility is the right place, but if we can keep you home for a long period of time and safe so that you're not falling, so that you're taking your medications correctly, and understand how to manage your disease or getting older or just had surgery or whatever, then that's what we do.
Yeah, and people, I think, like to stay in their own home if they can.
Absolutely.
Do you find it's a male or woman thing?
Not really.
Okay.
It's pretty much across the board. A lot of people kind of like, you always think of like mom and the caregiver and everything, and now all of a sudden mom needs the caregiver. Obviously, there's a little bit of a gender thing in terms of how long people live. Women tend to live a little bit longer than men, but that's not as true as much as it was like 25, 30 years ago.
Yeah.
So it's everybody these days.
Wow. Okay. Good to know. Tell us a little bit, Tammy, about some of the services that you provide.
We have the services are obviously you always think of like nursing. So the nurse would come out and go over your medications, make sure you understand what you're taking, how you're taking, when you're taking. That's one of the key reasons people go back into the hospital is they don't take their medications properly because they don't understand what they're supposed to do. I mean, we see people that have 15 or 20 or 30 medications to take in a day.
Wow.
That's a lot to keep track of. So we make sure they understand that. We have physical therapy. Physical therapy is strength, endurance, balance. Can you get from point A to point B safely? Do you need a walker? Do you need a cane? Do you have a walker now, but we can get you to a cane? Occupational therapy, people think of occupation as your job. That's not really what occupational therapy is. Occupational therapy is activities of daily living. Can I get up, get dressed? Can I go into the kitchen and get myself something to eat? Can I button my shirt? Those kind of things. Do you have the right equipment in your bathroom so you can take a shower safely by yourself?
Right.
Your daughter doesn't have to sit there in there with you because we figured out a way to make it safe. And then speech therapy isn't just, can you speak? It's, can you eat and swallow safely? Are you choking on your food? And there's also a cognitive component to both speech and occupational therapy that helps with patients that are having some memory loss, heading toward dementia, maybe early stage dementia, so that we can teach how to get the best of what you've got and make sure your family understands and everything so that you can keep that quality of life going. And then also people that maybe had a stroke that are having trouble speaking properly or have something that is a disconnect inside. So what they think and what they say is two different things. Speech therapy can help with that as well.
Excellent. So you guys cover a wide gamut of
We do.
services. Yeah.
Yes, we do.
Yeah, excellent. So how have you guys adapted since COVID? How has this impacted you?
What I will say is we never closed. We never stopped. We were all here. My office staff, we worked, we came in. Obviously, we were all masked up for a very long period of time, but we made a lot of changes in how we took care of our patients. As we learned things through the CDC and the medical community and everything, so we initially started out with N95 masks because everybody thought that's what you needed to do, and then we realized that unless a patient was COVID positive, and we took care of COVID patients in their homes as well, we just needed the surgical mask and so forth. So we still mask now because that's the recommendation in the medical community. So when we're out seeing patients, even if everybody's vaccinated, patients and staff, and most of the staff are, we're still wearing surgical masks. LHC, which is our parent company, made sure that we always had enough of any of the items that we needed, from your hand sanitizer and masks to N95 gowns, hat, the whole bit for when we took care of a COVID patient, so that we could make sure my staff was safe and my patients were safe.
Wonderful.
So
It's good to hear. Really good to hear.
Yeah.
So I know you all have over 100 years of teamwork here. So tell us a little bit about your expertise in this area.
Many of my staff have worked in home care for a really long time. Personally, I've got over 30 years in nursing, and 20 of it in Pottstown. But we've got, like, a lot of my staff have been in home care for over 10 years. Over 8 years, over 5 years. So there's a lot of experience here, and they're local. They've lived here. They know what's here. They know what the resources are. They know what the patients are experiencing because they're experiencing it too, either through themselves or through their family.
Right.
So we've been at it a really long time, and occasionally we get in some new blood because you need to be fresh. So you can't have everybody that's been doing the same thing for 10 or 15 years. So it makes it for a really nice balance. But overall, the experience level here is excellent, and the patients remember they want that same nurse back again, or that same physical therapist.
Yeah.
Exactly.
They get comfortable. So so it looks like you guys have a really good rating. Tell us a little bit about your ratings and.
CMS or Medicare has a star rating system. It's called Home Health Compare. It's you can find it online. They had Hospital Compare for a long time. Home Health Compare has been around for I don't want to misspeak, maybe 10 years or so. Right now we are a 4-star agency for quality, and that's above the norm. The average rating is between 3 and 3.5 stars, so we're a 4-star rating for quality, and that measures a bunch of different things. It's all outcome based. It's patients started out here and ended up here when we discharged. So a 4 rating is actually really, really good. The top is a 5. 5s are a little hard to get because not everybody gets better. Some people stay the same, and that counts against us. So they have to get better. So the fact that we can get 4 out of 5 people better is a really good thing. There's also another component to that, which is patient satisfaction. We're 5 stars out of 5.
Oh,
so
well, that's really important.
Exactly. So our patients love us, and we love our patients and their families.
Excellent. Well, that's kudos to you for being 5 out of 5.
Well, thank you.
Yeah. So tell us. I know you have some specialized programs for the seniors and your patients. Tell us a little bit about those.
We have 4 main ones. The first one is Active Life Balance, and that's sort of our fall safety program. But we want people to have an active life, a safe life. So it's a lot of people wind up back in the hospital because of falls, or they wind up not being able to stay in their home because of falls. So we have the Active Life Balance. That's a therapy-based program that makes sure people can ambulate safely and transfer safely and have decent balance and understand their limitations, and we work with their limitations. We have a low vision program for people that vision is continuing to decline, so that there's different adaptive equipment and stuff out there so they can actually continue to read their tablet or their newspaper or their magazine or their book, be able to see the television and so forth, and then how to work with that so that they don't have issues with falling or whatever because they can't see and so forth. So we work with that one. We have a continence control program, and it's more than anybody who's looked into it. They talk about Kegel exercises that help with continence control. There's a lot more to it than that, and we've had a fairly good success rating with that. It's predominantly women, but it's not just women. Men have the problem as well. And just to kind of get their life back a little bit so that they're not afraid to leave their house because they're going to have to go to the bathroom every 20 minutes, or they won't drink because, So, and dehydration's never a good thing, especially right now.
Right now, exactly.
And then we have some senior living programs that try to make the most of somebody who's in some type of senior living, whether it's an assisted living or a personal care or a memory program and stuff. We also have an Active Minds program, and that is specific for people with cognitive decline, dementia patients, to kind of figure out what level they're at and then to maximize that so that they can get the best and their family can keep them cognitive and with them and remember the good things and so forth as long as possible.
Yeah. Sounds like you got a lot covered here.
Yeah, we try to get every little bit.
Yeah, very nice. Good job. So a little bit about partnerships, your quality initiatives with Pottstown. Can you tell us about
Right.
that?
We have the bundling initiative with Pottstown and Phoenixville Hospital. We're one of their preferred providers for some certain things. It's all about quality. We want to keep people out of the hospital. We want to give them the best care possible and help them progress and our goal as a home care agency is to make you better so you don't need me anymore. That's my goal.
Right.
Which is sort of counterintuitive. We're trying to put ourselves out of a job, but that's okay.
Well, there's always more, right?
Well, unfortunately, yes, that is true.
Yeah.
So we do have the bundling initiatives with Pottstown and Phoenixville. We are not a part of Tower Health. Tower Health doesn't own us, so we don't have that piece of it, which is kind of okay right now. But so that's not impacting our stability or anything like that. We also have a rehospitalization preventive initiative with Sanatoga Court, Sanatoga Center.
Oh, good.
And then we also work really closely with Keystone Villa as well. We're in there several days a week in both their independent and assisted and personal care and memory care areas, so that we see patients there as well to kind of add to what they're already providing, because any more is always helpful.
Oh, absolutely, yeah. So who qualifies for this? How do you get services and who qualifies?
Because it's a medical thing, it needs to be ordered by the physician. So it's somebody who was, say, recently in the hospital, and we actually get referrals from the hospital. Recently in a skilled facility, whether for rehab or something of that nature, we'll get referrals from them. Doctor's offices that have a patient comes in for an appointment and finds that maybe patient's had a couple falls, they appear to be declining a little bit. Doctor just changed a whole bunch of their meds.
Yeah.
Or all of a sudden they're diabetic and they haven't been diabetic before, or their COPD that they've kind of lived with forever is now getting worse. So they're the kind of triggers that would send a referral our way. It is covered by medical insurance, providing you have this qualified skilled need. So Medicare pays for it 100%. Most Medicare Advantage plans pay for it 100%. Private insurances, it can be anywhere from 100% covered to you have a deductible or a copay. We always look at that first and make sure you know. Because we're not going to come out and see you and then hit you with a bill 6 months later that you owe us, 50% of the cost. That doesn't happen. We don't do that. And then, so we take, and if we're not in network, we'll help you find somebody who is. Because we're not going to do that whole out of network, kind of thing. That's not fair to people, and we won't do that.
No, that's good to know. Yeah. Tammy, tell us a little bit about what areas you service, where you're located. You're right here on Arm and Hammer Boulevard in Pottstown. What areas do you service in?
We service part of Chester, part of Montgomery, and part of Berks County. Basically, if you're seeing this on PCTV, we go there. Um, so it all the way up towards Reading,
wow, it's a
yeah,
big
all
area.
the way down to Norristown, King of Prussia, Chester Springs, Boyertown, Bally, Hereford, and then everything in between. So
Nice.
yeah,
So it's
so
a
it's a fairly large service area. So we're really lucky in that respect that we can
excellent,
take care of those
excellent.
patients.
So why don't we give the viewers your information if you need to reach out to somebody here like Tammy at TriCounty Home Health. They're located at 13 Arm& Hammer Boulevard, Suite 201 in Pottstown.
Hmm.
And what's the best way to reach you?
The best way is if you're not sure if you need service and have some questions, just give the office a call at 484-524-8592. You can talk to one of our intake people and they can kind of help you figure out whether it's something that, sounds like you qualify for services. And then you can either reach out to your physician or we can reach out to your physician for you. You need to have had a recent physician's appointment. If you haven't seen the doctor in a year and a half, Medicare or insurances are not going to cover our services. They're going to say you need to go to a doctor first to kind of identify what your needs are. We can help you facilitate that as well. But call the office first or talk to your doctor about it and see if they think that it's something that's appropriate. And then always, if somebody's in a hospital or a nursing facility or a rehab facility or whatever, just let the discharge planner or the case manager know that you're interested in home health services and that you want Tri-County Home Health, and they'll call us and give us everything we need.
Sounds really good. Thank you so much, viewers, for watching and learning a little bit about Tri-County Home Health. And thank you, Tammy.
Well, thank you. I appreciate the time.
You're very welcome. Thanks so much.
All right.